Hi, my name is Sandra and I'm a vocational skill tutor and assessor for student dental nurses. And this is me. I am a qualified dental nurse with 5 years of experience and a qualified vocational skill tutor and assessor for student dental nurses. Okay, dokie. So today we are looking at selecting the correct items for composite restorative filling. I'm so sorry, my picture looks a little bit messy with those numbers, but I hope you'll be able to follow me as I read. By the way, that symbol, which is a number 2 crossed, means single use. So if you see on any packaging this sign, that means they are not reusable, meaning they are single use only. Okay, let's start. So, number 1, aspirating local anesthetic syringe that comes with a single use needle adapter, which is number 2. However, every practice is different and they might use more advanced syringe units with already installed needle adapter. Okay, number 3, disposable needles. Length, long or short, depends on the tooth and arch, alright? So remember, the upper arch, which is maxillary arch, is only a short needle and infiltration technique is used, whereas the lower arch, which is mandibular arch, ID block technique is used if treatment is for 6, 7, and 8, meaning lower molar, sorry. And rest of the lower teeth are short needle infiltration technique. I hope that makes sense. Let's move on to number 4, local anesthetic cartridge. Number 5, that little bottle is bonding agent. And number 6, micro brush to apply small drop of bond to it and are most used after an etching gel, which is actually number 8. And it's used to create a rough tooth surface. So returning to the bonding agent, it's vital to promote. It's used to it's vital to use to promote optimal long-lasting adhesion between the enamel and dentin and the resin. I hope that made sense what I just said. Okay, number 7, high speed aspiration tip or just simply said suction. For fast moisture removal during the drilling, to rapidly remove fluids, bloods, and any debris from the treatment area. Moving on to number 8, which is acid etchant gel, as I mentioned before. And in dentistry, actually, it's primarily used to create a rough surface on the enamel or dentin, which improves the bonding of restorative materials like composite resins, sealants, and orthodontic brackets. Number 9, articulating paper, and it's a thin paper used for dentists to check and adjust the patient's bite. So it typically comes in thin strips, or maybe you could see like sheet coated with a special ink or substance that leaves marks when applying pressure. So basically, the dentist places this paper between the teeth and how the patient bite down and grind their teeth left right. So number 10, 3-in-1 tip that blows out air and water. Number 11, cotton wool rolls that are placed in the buccal or lingual sulcus to absorb saliva and keep soft tissues away from the teeth. I think it's quite straightforward. Number 12, slow contra angle handpiece, or as we usually say, slow handpiece. It actually runs at around 40,000 revolutions per minute, varying from low speed RCT and most known for removal of caries dentin to high speed conventional cavity preparation. I mean, by saying that, it means that fast handpiece opens the cavity and slow handpiece removes caries dentin. However, I haven't included in this picture slow speed bursts for slow handpiece and high speed bursts for fast handpiece, but we will come back to this some other time. Number 13. So actually it calls air turbine or fast handpiece, as we love to say, that actually runs at very high speed of up to half of the million revolutions per minute and use friction grip diamond or tungsten carbide boards to cut easily through the hard tissue. Sorry, I think actually I had this question at my exam. Yeah, I do remember something about the revolutions about handpiece. Just don't remember which one it was. Okay, never mind. Number 14, composite injector gun. I mean, I know it sounds quite scary, right? But usually we call it simply composite gun. Number 15, you can see right there, it's exam kit. Okay, maybe you can't see very clearly, but it contained a mouth mirror, college tweezers, BPE probe, and a right angle probe. And right next to it is a filling kit, which definitely you can't see what's inside, but it contains a excavator, or as I like to say, spoon excavator, amalgam plugger, burnisher, flat plastic, and carver. Okay, I will not explain in this video what each of those are for, but I promised I will return to it in another video. I promise. Number 17, single dose capsules called composite compose, or as we say, composite capsules. This single component contains the resin binder, filler, and a special catalyst. Which is only activated actually when exposed to very bright light using a setting system called the light cure system. Sadly, I forgot to add this to my tray when I made this picture. It is essential to put a light cure unit on your side and a protective light cure shield in orange color to protect your eyes from bright blue light. Please don't forget about that. I hope I have given you a more in-depth explanation of most of the items you need for composite restorative filling. I know I need make another video maybe to explain more about each instrument in exam kit and filling kit and maybe some finish touches for composite restorative filling, which already will be more advanced. But I will come back to it. Please leave a comment below to suggest any ideas for next video, and please hit that like button and subscribe for more videos. Thank you for watching. Bye.